Good morning, everyone. Welcome to this week's episode of Tooth Teacher Tuesday. Dr. Z here with another episode of Oral Pathology Corner. Hope everybody had a great Thanksgiving, and let's dive into today's topic. So, today's lesion is one that probably a lot of us have heard a lot about. Probably not too many of us, unless we have this particular habit we're going to talk about, have experienced this firsthand, but we've heard a lot of stories about this. And so, without further ado, our pathology for this week is something called, and the name is a doozy, it's called Smokeless Tobacco Induced Keratosis. I know, Gesundheit, right? So let's break down that name. What does that mean? So smokeless tobacco is referring to the little pouches of tobacco that, the chewing tobacco that some of us use and kind of keep down in the corners of our cheeks. And so that's the smokeless tobacco part. And then what those can cause, as many of us have probably heard about, is little patches of irritation, and that's what the word keratosis means. So, smokeless tobacco-induced keratosis. Essentially what it is, like I said, any users of tobacco pouches are at risk of developing this. Not everybody will, but I would say the vast majority do at some point develop this lesion, and it's a little irritation on the gums, kind of a reddish, whitish, pinkish patch. Kind of looks a little kind of bumpy. In fact, it looks a little something like this. And essentially what causes this lesion is just having any kind of, anything pressed up against the gums for an extended period of time can create irritation. But then on top of that, you've got all the chemicals in the chewing tobacco that creates further irritation and creates these lesions. And, without sugarcoating it, this particular pathology is considered precancerous. Doesn't mean it's any reason for immediate alarm, but it is a precancerous lesion. So, and part of our jobs as dentists is to counsel anyone who uses chewing tobacco or cigarettes or any other kind of tobacco products, talking about the risks of oral cancer that can develop from that. With the chewing tobacco, if someone starts to develop a lesion of keratosis, again, we don't want to panic. First things first is to just discontinue the use of the tobacco pouch, or at the very least, if it's hard to quit cold turkey, trying to slowly wean yourself off by putting that pouch in various other areas of the mouth so it's not constantly irritating that one spot. And then, like I said, just try to slowly wean yourself off of it. But with discontinued use of the tobacco pouches, a lot of times these will go away. And if that's the case, then we just continue to monitor and follow up at your regular checkups. If those lesions don't go away, then at that point it's a little bit more concerning. At that point we would recommend biopsying the area to see if it's in that precancerous stage that we would need to surgically remove that patch before it develops into full-blown cancer, if it isn't already full-blown cancer. So, take-home message is if you are a smokeless tobacco user, like I said, it's a risk that, I think a lot of us are aware of, but we all think it won't happen to us. So if you want to avoid the likelihood of developing that, try and quit. Talk with your dental professional about different methods for doing so, but the sooner you can discontinue, the better. And then if there's still lesions present after discontinued use, then you might need follow-up treatment. But again, fairly common for those who use tobacco pouches. The rest of us, we can develop other kinds of lesions, obviously, but wouldn't develop this particular one. So hope you found this informative, and as always, if you have any other suggestions for future topics, please let me know. Otherwise, have a great week, and we'll see you on next week's Tooth Teacher Tuesday.